Good day, everyone. It is Wednesday. I hope you're having a wonderful day. I keep hearing that it's supposed to be cold pretty soon here. I'm located in Georgia, but right now we have some sunny skies. So I hope you're having a wonderful and blessed day, that you're staying safe and staying healthy. Today is Wednesday. What, when, where, Wednesday. And here is your question for the day. All right. So with What, When, Where Wednesday, we discuss something that is kind of a category based. And today we're going to do some psychosocial. So, what should you study this Wednesday or today, whatever day you're watching this? How about psychosocial integrity? Um, and a lot of psychosocial integrity is understanding those psychosocial disorders, mental health disorders, and understanding what problems or complications those patients may experience. And you also want to be familiar with psychosocial because it's the only subject. If you think about all the content, cardiovascular, respiratory, um, GI, GU, all those content areas. Psychosocial is the only one that has its own category by itself. So you want to make sure that you're well diverse and that you pretty much understand a little bit of everything in psychosocial integrity. So when we look at that, psychosocial integrity is about 9% of the exam, and that's pretty much true for both the NCLEX RN and NCLEX LPN exam. All right. So this question, we're just going to look at the question, and then probably later on today, I'll come back and we'll discuss the answer. So just stay tuned and come back and see later today if the answer has posted. But this will give you time to review content and information. If you've never studied borderline personality disorder, go to your resource and just read a little bit about it. I know a lot of us don't like to read, but this does include a little bit of reading and just know the basics. Just jot you down some notes, put on a note card. What do I need to know about borderline personality disorder? And what ways can my testing strategy or my content or my confidence in myself, and what ways can any of those things help me to get to the right answer? Make sure you break down your case event. So the case event is the nurse is talking with the client who has borderline personality disorder. Our query is, what are they asking me? They're asking me to choose one of these four statements. One of these four statements, out of those four, which of the following statements would the nurse expect the client to make? So we're looking for an expected sign, symptom, or something that that patient will say that relates to someone who has borderline personality disorder. It sounds like maybe that's a symptom that they're exhibiting, or a problem, or something that they may verbalize or say, or whatever. So it sounds like something that is pertaining to personal personality disorder behavior. So we have to know a little bit about it. All right. So we have four options. I often feel bored and empty. I hear voices. Others are unable to hear. I need to go to my room to wash my hands again. I am worried the food on this meal tray has been poisoned. Now, when you look at each of those four options, you don't just want to answer. You want to use your process of elimination, but you're also going to learn from this question. You're going to see, what could they ask me about other options, other psychosocial disorders. What symptoms or statements could patients make that these statements may relate to? So you want to write down, well, who may say that they feel bored and empty? Who may say they're hearing voices? What types of patients might wash their hands, need to go to their room to wash their hands again? And what patients may say, you may have poisoned my meal, or I'm worried that the food on this tray is poison. So you want to write that down so that you're not only just studying personality disorder, but you may pick up on three or four other disorders, at least three other psychosocial disorders that are statements that could be made related to those patients. So that gives you a general overall synopsis of how to study three or four conditions very quickly within 10 or 15 minutes. Now, if you're using Saunders, I will tell you that what page that is on. Okay, if you're using Saunders ninth edition, which we use a lot in my tutor sessions, It is on the page 966, and this is unit. This kind of last to the next to the last unit, not the complex unit, complex care, but it is in the unit that's mental health problems, chapter 66. So your unit that deals with mental health, chapter 66, page 966 starts personality disorders. So you want to just kind of review what does it mean? How do you describe that? What does it mean when a person has a personality disorder? What are the characteristics? What type of mood that they're going to have? Interventions for paranoia. They talk about antisocial personality, borderline. So this is more specific to what we're dealing with. We're dealing with the borderline, and there's just one little area. It's part 4.4, and there's A through L. There's also cluster C. All right, and general interventions overall for a person with a personality disorder. So that's a good subject area to look at, and maybe specifically go down to the borderline, because there's different types of personality disorders. All right, so we're going to discuss this question when we come back later today and see if you get it correct. See if you can answer it. See if you got it correct. All right, enjoy the rest of your afternoon. Talk to you soon.